And we are the Coalition, loud and proud, outrage porn free, civilly disobedient media broadcasting live on the worldwide Coalition Radio Network at coalitionradionetwork.com, facebook.com/the Coalition Radio, on the mighty Twitter at coalition_radio. Earlier today, an organization released a press release about the ongoing, if you will, vaccination mandate/employment crisis. Nicholas Oliver, who is the executive director of a new organization called the Rhode Island Partnership for Home Care, delivered that, if you will, press release in conjunction with the chairman of his board, Mr. Michael Bigney. I am happy to count Nicholas Oliver as a friend and someone who's appeared on the show in a number of formats and a number of occasions over the years. And it's at a day like today where emotions are raging that an organization like his brings a sense of clarity, if you will, to a difficult environment. Anyone who's followed the Coalition over the last few weeks knows that we've been on the spot broadcasting protests by a number of groups who represent home care providers, healthcare providers, first responders, any one of a number of folks who, as they would tell us now, a mere year ago were heroes, and now, quite frankly, they're being treated like, zeros. What do I mean by that? Currently, and we're going to ask Nick to go into a little bit of detail tonight, but currently, the governor has created a situation where licensed healthcare providers of all varieties are faced with a decision by October 1st to either receive the mandated vaccination or lose their jobs. Additionally, they face the prospect of also losing their professional licensing. Now, anyone who's watched this show over the years know that as a libertarian, I am not a fan of professional licensing. Quite frankly, I find that the state's intervention, if you will, is largely revenue-driven. And quite frankly, I would rather leave it to the professional bodies that are heavily invested both in the training, the education, the ongoing research surrounding those individual healthcare, if you will, ecosystems, be the ones mandating it. And here's a perfect reason why, because you have a state who's hell-bent on, if you will, enforcing their vision, and they're able to hold over the head of folks who in some cases have been involved in healthcare for 30-plus years the key to their financial future. Now, again, it's an emotionally charged issue. There are allegations, of course, that you cannot perform health care professionally if, in fact, you're not vaccinated. We'll talk about that tonight. There's also the fact that many of these same healthcare providers were asked to and complied with work environments in the beginning of this, if you will, pandemic that did not include proper PPE, certainly did not include vaccination, and left little in regard to their personal health. Hence the term heroes. Because these folks, on a scale heretofore thought impossible, performed nobly in the midst of a pandemic for which we had little information and even fewer answers. Now flash forward, and the state has decided to intervene in a way that, in my personal opinion, is draconian. Now, individual employers have the right to hire and fire as they so choose. Most of the folks that I'm talking about are disappointed that these long-term employers would reduce it to this type of decision, but I think ultimately they recognize that. But to also make it virtually impossible for these folks to be employed anywhere else because of this professional licensing is, in my personal opinion, as we like to say here on the Coalition, arbitrary and capricious, and holds no place in a workforce, in a workplace environment in the year 2021, particularly given the sacrifices that these folks have made. So with that as sort of a backdrop, this conviction that one cannot survive without vaccination, and one certainly cannot be a part of the healthcare community, and at the same time the state ready to do virtually whatever necessary to have these people comply with their edict, we've got organizations with ongoing relationships at virtually every level, if you will, of the healthcare food chain. So we asked Nick to join us again tonight to sort of explain it all to us from his perspective. Mr. Oliver, welcome back to the Coalition, and thank you for joining us for what I'm sure has become, and I think I'm painting this lightly, hectic and chaotic. How are you?
Thank you, Pat, for having me on your program, and thank you for providing this important information to your viewers and listeners.
I wanted to have you on because I want to get right to the source. Let's start, first of all, it's been a little while since you've been on, and yes. It takes some time, if you will, to talk about your organization, what it does, and its perspective on what some would call euphemistically a terrible turn of events.
Yeah. So the Rhode Island Partnership for Home Care is the state's trade association for licensed home care, home nursing care, and hospice providers. Who are these folks? These are companies that are in communities throughout the state of Rhode Island that are licensed by the Rhode Island Department of Health to deliver healthcare services in the home that include activities of daily living support and homemaking to prevent homebound vulnerable Rhode Islanders from having to enter into a skilled nursing facility, such as a nursing home, or another more expensive facility-based care setting, to those that have recently had surgery and need limited post-operative care, to those that need long-term skilled nursing services, palliative care, infusion therapy, all the way through end-of-life and hospice care.
Talk to us about the range of services and individuals and skill sets that comprise the home care community.
Yeah, so not only are the companies licensed, they are required to hire licensed professionals and paraprofessionals. Professionals being nurses, RNs, or registered nurses, LPNs, licensed practical nurses, physical therapists, occupational therapists, speech language pathologists, social workers. They are also required for personal care or activities of daily living support. We can't hire what you may hear in other states or may see glorified in the movies and television, home health aides. We're required by the Department of Health to hire licensed nurse assistants. In other states, they may call them CNAs. They are not certified, they are licensed. And they have a rigorous process in order to become licensed to perform their duties, and are subject to relicensure on an annual basis with ongoing continuing ed. It is strenuous work. It is many times thankless. I think this is one of those examples, as you characterized the hero to zero. I've said it a little differently. In 2020, we were codified as heroes, and then Governor McKee, with the swipe of a pen, vilified us. And that's what we're facing today. This is thankless, rigorous work where the person that's coming into the home providing care to our most vulnerable homebound Rhode Islanders, over 21,000 Rhode Islanders are provided with daily home care services in all 39 cities and towns, but they're not being provided care in a facility like a hospital or a nursing home. They're being provided care in their home. So we're going to just about 21,000 different locations providing this service. And what it does is that it helps stabilize them. It keeps them safe at home, and they're able to remain in their community. And they're also saving the state and private insurance, depending on what their payer source is, precious dollars by not having to be in a more costly facility-based setting. Um, our our people are heroes, and they are really doing great work providing optimal care in the community. And we have been tirelessly working throughout this pandemic, making sure that we are keeping as many people as we can out of the hospital and certainly out of risk of infection from COVID-19. And we've done an excellent job in comparison to any other long-term care setting. So much so that there is not enough data that the health department would be able to track as far as number of patients that have been exposed because of their home-based healthcare worker.
Talk about, too, the amount of stress that folks in the employ of your providers take off the healthcare system in Rhode Island physically, let's just say even during a quote-unquote a normal year. How many folks are they literally keeping out of, on-site facilities, Rhode Island Hospital amongst them, Miriam, all of them, during, I'm not even sure what constitutes normal anymore, Nick, but what talk about that. Give voice to that.
Yeah. So as I said, we provide care daily to about 21,000 Rhode Islanders. Certainly not all of them are nursing home eligible, but the vast majority are, and they're on long-term care service. And we provide stabilization in the home to meet their medical needs, to meet their activities of daily living support, because we just don't have enough nursing home beds in the state to provide that level of care. Just recently announced that we're losing another nursing home, the Blue Home in Woonsocket, 43-bed facility that is no longer available to those that need their services in the state of Rhode Island. So it puts even more pressure on home care providers to be able to have a qualified and accessible workforce to meet the growing demand of Rhode Islanders who need our services. We know as baby boomers age, that is the next wave of a large population that's going to need our services. And we know that more of that population is going to have complex medical needs, not just physical needs, but also have behavioral care, psychiatric issues, Alzheimer's and dementia, and will require a significant amount of services. The problem is that pre-pandemic, we were struggling to be able to hire and retain staff, and that's largely due to low reimbursement rates from commercial insurances and the state Medicaid program. And now we're seeing yet another wrinkle to that with this emergency regulation that is going to prevent us from being able to stabilize the current census of patients and clients, never mind our current struggles with the inability to fill new cases, predominantly those that are in the Medicaid population, which tends to be our most vulnerable homebound indigent population. And those folks tend to be in the metropolitan area, tend to be members of Black, Indigenous, or people of color, BIPOC community. And those folks are underserved as it is. But this emergency regulation further prevents access to care, which is counter to the state's mission to provide more access to care in less costly settings. Home care is the solution for cost effectiveness, for enhancement of quality care, but we can't do that when we're constantly being thrown roadblocks that make us unable to be able to have the workforce needed to meet current demand, never mind stripping away healthcare workers that are not accessible to current patients because of an arbitrary deadline.
And it speak to, if you will, the improvement in quality of care and also quality of life that in-home healthcare affords the typical patient?
We're able to keep people in their homes longer. Their satisfaction, their quality of life is improved by their ability to remain in their home, many of whom have lived in their home for multiple decades. They had their family there. Some of our patients will tell us that not only did they raise their children, they raised their grandchildren there. They live there with their spouse. And then now they're in the twilight years of their life and they don't have the ability to stay there safely without the services that we provide.
Mhm.
It's important. Our average patient is an 85-year-old widow who has their next family member lives more than 10 miles away. Um, I'm born and raised in Rhode Island. We make fun of how if you have
Right.
to drive more than 5 minutes, you have to pack an overnight bag and plan for a minimum 2-night stay. Unfortunately, though, there's substance to that joke, and that we hear all the time that they don't see their family member, or that the home care worker that comes in is the primary or only person that they see over the course of a day or course of a week, and that they may not see their family members till the weekend, or may not even get a phone call, or in their time of need, when something acute happens, that they contact us versus that family member. That relationship is so important. But I don't want to diminish or characterize us as only providing care to elders. With this emergency regulation, we have people from all across age groups that will be impacted. And, if you ask me what keeps me up at night, I certainly think about our elders that may be without care, but I'm also thinking about, those that are medically fragile pediatrics that will be losing their nurse that they've had for years, or maybe the only nurse that they knew, because their nurse is unable to be vaccinated at this time, not because they're not choosing to do such because of political or religious reasons. It's a very small group of our staff that are not vaccinated. Most of them are because they need a temporary medical exemption, and the governor and his health department are not allowing that. And it's degrading that relationship between a physician and their patient. And it should not be the burden on us as employers to determine whether or not you should get a vaccine, or to mandate that they get a vaccine if they're being treated for advanced chronic illness, or if they're experiencing a difficult pregnancy, or they're in the middle of a clinical trial and they are being advised by their physician, get the vaccine, you are immunocompromised, but not at this time because of treatment or the care that we're providing. No one should dictate or counter the advice of their physician. And that's a big barrier for us. And that's the plurality of those that are not getting the vaccine at this time. And what the end result will be is that we could see up to 1,100 people that we will start discharging as early as tomorrow and over the next 30 days until the October 1st deadline, because our staff cannot or will not be vaccinated by October 1.
We ask an awful lot of these folks, don't we? And what I'm talking about, of course, are the variety of staff members at a variety of organizations, again, ranging from social work to physical therapy to in-home CNAs to nurses. I mean, talk about their workload in normal times, and then if you can, reflect on the impact of the pandemic on their workload and overall stress, particularly in the early months of the pandemic when we had so little information and really nothing to offer these folks in terms of protection.
Yeah, it's absolutely physical labor. It's lifting patients, providing assistance when it comes to bathing or dressing or toileting, all things that we don't wish to talk about in the public forum. It makes a lot of people uncomfortable, but that's the services that we provide. And it is strenuous work, and we provide it daily. Those are all activities of daily living, and it's what keeps us out of the hospital, the emergency room. It's what keeps us out of skilled nursing facilities, that we're able to provide that service to these vulnerable homebound patients in their home. Over the past 18 months, these folks are true heroes. They don't have the same level of support as they do in a facility-based setting, just by the design of how home care is delivered. If you have an issue with a patient in a facility-based setting, such as a hospital or nursing home, you can go down the hall and you could grab another nurse and provide an assessment to a patient. It doesn't work that way. In almost all cases, we are not allowed by Medicare and Medicaid regulations, which dictate other payer sources such as commercial insurance, like the Blue Crosses and the neighborhood health plans and the United Healthcares of the world, from having more than one healthcare professional or paraprofessional in the home at the same time. So you're calling a field nurse supervisor to come in when something happens and you're waiting for them to arrive. You have patients and clients that are watching the news because they're home and they're glued to the TV looking at information they watched at the time our previous governor on TV on a daily basis, and it frightened them, the information. And if they are in a vulnerable age group, or of course they all have vulnerable health conditions, they're nervous about what could be coming to them and how they could acquire this this COVID-19 that they were just learning about. We were asked to answer questions, and we were a primary information source. We ended up being case managers and social workers and therapists, calming our patients down, providing them the right information, providing their family members, especially those that lived with them or visit them, on how to take necessary precautions. And we were doing this without adequate access to personal protective equipment, which the state struggled for months to provide us adequate equipment. And we couldn't compete in the market to purchase these because they dramatically skyrocketed in price. They became harder to find. We could not compete at all in the foreign market. We're all a group of small providers. It made it very challenging. I mean, we were talking in the early days about reusing paper masks and the health department advising us to put them in paper sandwich bags for reuse. In those early days, they were providing us instructions on how to cut a large black trash bag into a PPE suit. That's what we went through for the first few months. If you're told that you have this deadly virus that you may contract as a healthcare worker just by the normal course of business, and you're being told to reuse a paper mask, or here's how you can be crafty at home to cut a suit, I will tell you, those are scary times. It's thankless. It was a lot of lack of information, a lot of misinformation that was provided in those days. And we didn't have an advocate in the health department or in the governor's office at that time. So much so that our governor was trying to push a private service that has a horrible reputation for patient safety, instead of promoting her adequate and licensed and quality network of home care providers that are licensed through the Department of Health. So that's the strain that they went through the early days. And we're still living with some of those effects today, while we still remain the same leadership with the health department, albeit a different governor who was not allowed in the early days of that process because he was dismissed by the previous governor.
And all the while many of us were able to, quote unquote, shelter in place, we're able to stay home and receive benefits, we're able to make arrangements to work remotely, we're given additional funds to incentivize folks from the federal government to stay home. While all that's going on, these same healthcare workers still showed up to work, still maintain that quality of care for their, and I won't even say pay customers, because I've seen it firsthand, and more often than not, they become family members. It's an extension of the family. And imagine the stress if you're a son or a daughter and you live in New York State, for example, as so many folks have left the state, and you literally cannot go home. You cannot go see your parents, or you cannot help pitch in to take care of that maybe adult child, who in so many cases, because of so many issues, paid healthcare workers are going in and effectively maintaining that support system. Imagine if you can't do that, and the only thing holding your family structure together was these folks. Well, so many Americans got to stay home. They went out on the road. They went into strangers' homes, new customers, new patients, new family, whatever you want to call the relationship. They did this without question. I'm not aware of any situations where these home health care workers walked away from their responsibilities. And we're not talking about folks who are making an overwhelming amount of money, are we?
No, not at all. And you're right. These are people that went to work the very next day after the previous governor announced our declaration of a public health emergency. They went to work the next day with precautions, but otherwise it was the same work the next day, and continued to go to work, even though they were concerned about exposing their family, compromising themselves. There wasn't enough information. It was a frightening period of time. It's still a very concerning period of time, but we showed up, and we continued to show up because we needed to provide continuity of care of our patients, and patient quality care is paramount.
And at the same time, given the body of thought at the time and the reality, risking their own family, because for many of these folks, there was no hotel room waiting, right? For many of these folks, if they stayed someplace else, it was on their own dime. Or in many cases, and I've heard the stories and I know the people personally, they set up literally, for lack of a better term, segregated facilities in their own home with separate access and egress. And
if they could do that, yes.
And saw their families, but lived separate lives for months at a time. While we wondered who would get testing and who wouldn't get testing, and we did the dance with the opening and closing of restaurants, and we pretended plexiglass made a difference. All of this crap. These folks live this, and I'm spending so much time on it because I don't know if it's possible to understand the sheer volume of stress, the sheer volume of pain and worry, while you're A, not making a lot of money, B, working your heart out, C, doing so under conditions that were being routinely reinforced as dangerous and unhealthy. And now we come to this. Speak to, if you will, some of the training requirements and the licensing requirements and how long it takes. For example, there was a young woman at yesterday's protest who had just gotten her license as a CNA. And had then found out she didn't have a job. What's involved in becoming a licensed healthcare provider at some of these different levels?
So you asked about nurse assistants. That's 130 hours of initial training that provides practicum experience, meaning field experience. They're required to take a in-person written exam and then an in-person physical exam to demonstrate the competencies of care. Once they're licensed, they are required to have 15 additional hours per year of continuing education or in-services in order to maintain their licensure. Certainly skilled professionals, there are a number of job classifications. They require college education, a degree, they have a licensure process, and then they also have continuing education requirements. For our professionals, many of those that it is on their own expense. For our paraprofessionals, our licensed nurse assistants, those in-services are in large part provided by the provider, but we don't get reimbursement for that. You spoke earlier about wages. Wages are really low when we talk about our nurse assistants. Pre-pandemic, we were talking about how we had just hit $15 an hour, and that was something that we committed to the previous gubernatorial administration by 2020, and we achieved such. And our reimbursement rates were changed through the Medicaid program and other payers to get to that point. And at that time, we were competing with other healthcare settings who could pay more because their reimbursement rates are higher. But we were also competing with that group of workers with retail and hospitality that could pay higher because it's private money. I think I'm hesitant to call it a post-pandemic economy, but an economy that will hopefully emerge from this public health emergency. Things are different. You talked earlier about the ability to work from home. One of the most popular employers are financial institutions. And if we're offering now about $17 an hour for nurse assistants, but a call center, which is allowing computers and phones and go work from home, they're offering you $22 to $23 an hour. We have providers who are going to say, hey, look, I can stay at home versus traveling and going into people's home and helping them with toileting and feeding, right, versus I can be with my kids, a more flexible schedule and all the comforts of, sitting at home. Which option are you going to take? Well, that's a no-brainer. And it just goes to show, again, how thankless, care delivery is. One of the things that you had said earlier that I want to make sure that I touch on is you talked about how there was additional money that went to certain Americans for staying at home. That was not the case in home care. There was money that went to long-term care right away through the CARES Act, and that went predominantly to hospitals and nursing homes in March, April, and May. We didn't receive money from the CARES Act until November and December, a very time-limited experience offered through the remaining money from the previous governor in the spend down of the CARES Act money because there was a federal deadline to spend it. It wasn't much money. It was under $3 million. And it only went toward our nurse assistants that provided care for Medicaid cases with the encouragement of hiring new nurse assistants or nurse assistants that were currently not working. So if you were working throughout the pandemic at that point, 7+ months, and you were not eligible for receiving additional money, hazard pay, whatever you want to call it, incentives. If you're a nurse, if you're a therapist, if you're a social worker, you work in our offices, you were disqualified from receiving those additional benefits. In the end, we weren't able to spend that money because we weren't able to spend it quick enough. And we weren't able to spend it on hiring new folks. There wasn't a lot of people coming knocking on our doors saying, yes, we want to come in the middle of a pandemic. So you used a couple of adjectives to describe when things are egregious and capricious. That's one of those that it faced. And we haven't received additional monies since federal aid to the states to provide for home care. So again, another thankless way of not supporting our heroes. Right. I don't want anyone to think of your listeners here that there was a lot of money that came down to all healthcare providers. That was not the experience for home care.
Yeah, and a lot of that money went to private sector jobs, in private sector companies, which, there was need everywhere. There still is need everywhere. It's a mess, and we, I use the words arbitrary and capricious because there's a certain Commerce Secretary who winced every time I used that term and took great offense at it, which, of course, you know me well enough to know that meant I used it constantly. But you had this incredible level of learned ignorance about exactly how our healthcare system, and I use the air quotes, works. Nurses, CNAs, orderlies, any one of the number of support, especially what I mean by that is respiratory therapists, folks, inhalation therapists, folks who do radiology, all of that. Those are the folks that are truly the backbone of our medical system. And so in an era when we're looking to put people and keep people at home for cost savings being the primary motivation by at least government and big business, we understand that there's a positive side, a significant impact positively in terms of quality of life. We get that. But at a time when telemedicine and we're literally doing everything we can to offshore, if you will, from traditional medical facilities. At a time when we're doing that, we would put these people under the gun. Is astonishing and made even more, and for lack of a better term, insane, was the announcement from the Rhode Island Department of Health today that they were looking to keep people out of emergency rooms. Because, why? Well, sports fans, if you didn't know, there's a shortage of people to work there. And right, that comes a day after an executive order was issued, which said we'll take nurses and medical professionals out of retirement because there's absolutely a lineup of people in their 60s and 70s desperately looking to work in this environment, who may or may not still have licensing in place, who may or may not still have current training in place. So, Nick, I got to ask you, you've got this crazy juxtaposition here of an acknowledged shortage in healthcare workers and trained healthcare workers, an acknowledged desire to keep people out of facilities for all the reasons we mentioned, and at the same time, an administration that is hell-bent on decertifying and potentially supporting the firing of the very people who literally carried us on their backs through the last year and a half. Can you make sense of this for me? Because I'm having trouble here.
Yeah, I think that Governor McKee has a plethora of nurses running to come back and work in the middle of a pandemic, like Mitt Romney had in 2012 of binders full of women. It doesn't exist. It's hard to make sense of the illogical. Mm-hmm. And when this administration says that they talk to healthcare providers that are supportive, the only ones that the governor and the health director talk about are the two leaders of Lifespan and Care New England. And as much as I have great respect for Dr. Babineau and Dr. Finale, and I believe that their voices are important in this discussion, they're not the end-all, be-all. And Lifespan, for example, doesn't even operate a home care agency. Care New England does, and my association does represent them, and we're proud to do such. But they're not the only voices in home care. And what they're able to do in their facilities is not something that we're able to control in a home-based setting. We cannot tell the patient, one, get vaccinated. We can't mandate them to do such. We can't close their houses down and not allow certain people to live there or to come visit them. And I don't believe that Governor McKee wants to move into a direction of limiting group gatherings, especially when he has over 81% of adults that are fully vaccinated. And mind you, he has approximately 92% of home care workers that are vaccinated, that are under this mandate. And yet he has teachers, as he said, that's approximately 90% that are also state licensed without a mandate. I think that there's more at play. I'll let those that play in the political fields better than I do. I like to call myself a recovering politician. I'm not running for office at this time.
Right.
I'll let those folks spectate on that further. But I think that there's something at play, and I think a large part of that has to do with who supported his lieutenant governor campaign in the last 2 cycles. And I don't believe that he had significant union support from the 2 largest healthcare unions, and he's trying to garner the support from the teachers union and trying to win off of his play with the Providence teacher union contract.
Right.
And I think that the 2022 September primary has a lot to do with this decision making over an adequate need when you have 82% of the population that is voluntarily vaccinated. And that's bigger than any group that had voted for either presidential candidate in the last presidential cycle. So the only one who's making it political, I believe, is Governor Dan McKee, and doing it at the backs of healthcare heroes that are making villains in the following year.
And as my good friend Matt Allen on WPRO pointed out the other day, there are also aggressive treatments that are currently available in Rhode Island for those who do contract the illness. So we've got a significant percentage of the overall population that is at least 1 shot vaccinated, a pretty significant portion of the population that's 2 shot vaccinated, an overwhelming percentage of the healthcare workers, yet you've got this body of folks. And we are, in terms of healthcare, living on the verge of a nervous breakdown, as they say. And I just want to also point out, anecdotally, I don't know anyone who's ever met a nurse or what we now call a CNA who has spent 30 to 40 years in the workplace and seen the impact on those folks physically. And I'm talking about back issues, shoulder issues, leg issues, in addition to just the joy and glory that comes with being a seasoned citizen, as we say here. All right, the notion that any of them are in a rush to come back is frankly ludicrous. And I just want to see the lineup. Listen, I'll applaud them, but I want to see the lineup of folks that are willing to do that, and because it's simply not going to happen. It is utter and complete fiction in my mind, and I would need to actually see documented proof to believe it is anything other than that. So
yeah, it's strenuous work. You're absolutely right.
Mm-hmm.
And healthcare workers have, and you know, you're always afraid in this line of work of having a PolitiFact check on you and you misquote, but you know, healthcare workers tend to have of the highest workers' compensation claims. I'm trying to remember a study from Beacon Mutual. I know construction workers are on that list, but it is a higher risk profession because of all of those strenuous actions that you take to help lift patients,
right,
to provide them support, to be able to bend, to lift, to move. And with that, ambulation over time does have wear and tear on joints. So you have people who retire with their own musculoskeletal issues. It's very strenuous work. These folks, as I say, they're heroes. And I say that all the time, even pre-pandemic. You would hear me talk and liken them to, you know, angels and you know, in the spirit of Florence Nightingale, because
right,
they're the backbone of healthcare, and they're the saving grace for costs for healthcare, and they are underappreciated, especially by decision makers who just don't understand our delivery model.
Right. And I'll say this, and this is not, I'm not going to ask you to respond to this, but having attended way too many meetings with the head honchos of the Rhode Island Department of Health, those folks need to understand that the population of Rhode Island, whether it be the patient population and or the caregivers, are not figures on a PowerPoint presentation. And yet, quite frankly, that's how they're treated. The level of disrespect based on the sacrifices these folks made, while so many, you know, we talked on the coalition, we had the opportunity to question Jeaner, and we routinely ask Jeaner about the notion of shared sacrifice. And shared sacrifice in the state seems to be a one-way street. And it's the worker bees in this state who engaged in shared sacrifice on a level that is astonishing, particularly when in comparison to the lack of said shared sacrifice by the folks who, and I use the term loosely, run the state. So it's disgusting. Now, we've got a situation, and I know you touched on this a little bit, but I'd like you to re-explain this if you can. And I'm reading from your press release. Current projections have over 1,000 home care patients and clients without continuity of care by September 30th, 2021 due to healthcare worker displacement caused by enacting this emergency regulation. While this figure represents only a small fraction of providers' cumulative census, this will impact home care patients and clients residing in every Rhode Island city and town. The Rhode Island Partnership for Home Care has requested that the Rhode Island Department of Health exempt home care from this mandate. So let's go over the mechanics of this.
Sure.
What will happen in the next few weeks? So that, because what you don't hear the state doing ever, and this is not just the McKee administration, but ever, is folks explaining what's going to happen. And so as someone like yourself, and again, I want to thank you for joining us tonight, because I know it's been a long day. You've spent a lot of time in major media explaining this. But you're the only person, from, if you will, the management/government milieu that seems willing to do so, to your eternal credit, by the way. From your perspective, what is the timeline and what will happen if this mandate is left uninterrupted?
Yeah, so testing starts tomorrow, and our healthcare workers need to be tested twice a week if they are not vaccinated. And I just want to be clear because, although I don't necessarily follow the trolls on social media, my members, it would be amiss to not mention that, there are certain interest groups out there that are already characterizing us as anti-vaccine, and that's something that we're not. We're encouraging.
Take a second to clear that up, because that's
Sure.
and thank you for bringing it up, because that's a critical distinction. I have yet to find, the current parlance, the term is anti-vaxxers. I've spent a fair amount of time over the last couple of weeks with a lot of really good people, and explain their perspective from what you see.
Yeah, because I've been even told that members of the General Assembly are trying to characterize that in my credibility, and I don't believe that I should even provide them any oxygen to that discussion, because that's just not our position. And we have been educating our patients and educating our staff throughout the pandemic about the importance of testing. And last December, when vaccinations were provided for emergency use authorization, that we educated them on their options and continue to do such. So no, we're not anti-vaccine, but we do believe, as we talked about at the beginning of this discussion, about how sacred the relationship is between a patient and their physician, and that the physician's advice is paramount, and that patients need to make individual decisions based off of that guidance and advice from a physician, particularly those that have health conditions that may determine what vaccine to get or when the right time it is to get a vaccine. And that's our position. It's not anti-vaccine at all. And I think we've done a really good job about that, because we talked about how approximately 92% of our workforce is already vaccinated, and that's higher than any other group that Governor McKee has talked about or has heralded as not needing a mandate over others. As far as what the next steps are, is that when a home care provider cannot provide care to a patient, and continuity of care is what it's called, is interrupted. And whether that's because there was an incident in the home, examples are a client or patient may physically assault a nurse assistant. It may be that there is an issue with another family member living in the home that is preventing us from providing service delivery. Those are issues, for example, that we can't provide care. Or if a staff member quits and we can't supplement somebody, we don't have substitutes in our industry, to be able to provide service, we have to report that. And we have to report that to several state and municipal agencies. Those are one-offs. But if we're projecting over 1,000 workers, over 1,000 patients that will not receive care starting tomorrow when resignations start becoming effective and our staff start to leave, all the way through the next 30 days, there's no system in place for the health department to accept these neglect cases in mass. So what we're asking for is that, short of an exemption, the health department, in making this decision and releasing these emergency regulations back on August 17th, it should have included a process for home care to provide reporting in large groups of patients that will no longer receive services. There's no plan of action for that. I think that that's in large part due to the health department, even though they heavily regulate us, not understand how we deliver services. It's not as if you can change your ratios or call a staffing company in a nursing home and say, hey, we're down a couple of nurses or a couple of nurse assistants. Can you fill this shift? We don't have that option in home care. And a lot of times the nursing homes and the hospitals are the ones calling the home care agency to serve as that staffing agency service. Right. So it's blood from a stone. And the health department doesn't have that procedure yet. And where it's going to fall on is the long-term care ombudsman, the state Medicaid program, mayors and town administrators who are going to have increased demand for social services, and calls for help to say, I just lost my home care nurse or my home care CNA. I have no idea what to do, but I'm going to end up in an emergency room if I don't get services now.
But wait a minute.
A lot of burden.
I got to jump in. We were just told not to go to emergency rooms.
Yeah, isn't that interesting?
Yeah. I mean, literally today, Dr. Chan made the rounds and said, we don't want people going to nursing homes unnecessarily. So what constitutes a necessary visit? If you've got someone with a long-term care relationship who has got mobility issues, dietary issues, ambulatory issues, health issues, and on and on and on, how is it possible for the government of a state that's about 44 miles tall with, depending on who you talk to, somewhere around 1 million people, how is it possible that individuals from the same agencies can act at such cross purposes?
So they're trying to prevent hospitalizations because of potential breakthrough variants for COVID-19.
Right.
Dr. Chan and company have displayed that we have an insufficient primary care workforce to be able to deal with subacute healthcare issues, that people don't have a primary care physician to go to. They don't have a community health center to go to. And so they're using the emergency rooms as primary care facilities. So and that makes sense to share the message under a non-pandemic period and try to increase the primary care workforce. But that's a separate discussion. But the third wave that they're not talking about are people who are going to lose their long-term care services, primarily in home care, although now we're worried about nursing homes closing as well, that there isn't enough healthcare workers to provide stability to vulnerable Rhode Islanders, that if they do not have continual service, they're going to end up in emergency rooms as well. And the hospitals don't have the capacity for that in the normal environment, never mind in an ongoing public health emergency with limited financial and staffing resources.
Wow. And might I add that Rhode Island is amongst the most difficult states in the nation because of certificate of needs and politics to open up, if you will, new facilities, particularly urgent care facilities, which are operating primarily under private rules, private ownership, and private risk capital, because why would we want additional capacity in healthcare? Let's control it. So you've got this situation where large facilities are being largely protected from competition at a time when we don't have enough staff, at a time when the need for urgent care staff is as desperate forever, while simultaneously making it impossible for home care people to do their jobs, and as a result, actually work to cull the herd, if you will. I apologize for that term, but that's seemingly the uncaring way that they look at this, and seemingly and making that staff smaller.
Yeah, I would push back and say that I don't believe that Governor McKee or the health department don't care. I don't have anything to say that that's the case. And we can have a difference of opinion, but I think it's a matter of they don't know what they don't know, and they regulate what they don't know. And it required having conversations with other than a couple of hospital CEOs before implementing such a mandate and talking through what they believe is the need. Let's work through a lens of utilizing data to make decisions and understand the environment of service delivery in and outside of a facility, including home and community-based settings. And that's where my criticism lies. It's not on the individuals, it's on the decision-making process and the lack of voices in the room and the urgency that may be created for extraneous or political purposes. That's where my criticism lies.
And I will just in a friendly manner debate you on that point, because this same MO, if you will, has been on display since the beginning of the Raimondo administration, and by definition, the beginning of the current Department of Health administration, who in every single aspect, in every single matter, has had this same issue time and time and time again. I'm oversimplifying. I get that. But how else can I explain this repeated ignorance of a fundamental understanding of a dangerously overloaded health system, dangerously underfinanced health system, and I'm talking about before the pandemic. They've never asked the questions. They've never, every decision they've made has been this skewed, isolated, again, I call them the PowerPoint doctors, and that's just my expression, because I don't know any other way to explain over a period of 6.5 years, the same tired inability to connect the dots. How's that for keeping it clean?
Yeah, I won't compare Gina Raimondo to Dan McKee. Clearly, there was not a collaborative relationship there, and yes, Dan McKee inherited the previous administration, his cabinet,
absolutely.
and his decision makers and indecision makers, as I call many of the folks that are in the room that aren't providing proper guidance. And he still has some of those, and he should accept responsibility for that. And I think we'll see some cleaning of the house, and we've already started to see that with the news of late with his chief of staff. Mm-hmm. What Governor McKee owns that is unlike his predecessor is that Dan McKee had the opportunity to learn about long-term care. He sat for 6.25 years is one of his 3 constitutional responsibilities as lieutenant governor, is oversight and chair of the Long-Term Care Coordinating Council.
Interesting.
And his attendance at those meetings, I would love to have somebody look at, because it was not high. And it was allowed to have an outside person who doesn't deliver care, who's a registered lobbyist with extreme political views, facilitate long-term care coordination. And this person has been carried over with the new lieutenant governor, Sabina Matos. So it's a series of indecision, and it's a series of, I'm not going to inform myself when my constitutional office does not have many responsibilities. This was an opportunity for this governor, unlike the past governor, or even several past, to be able to be educated on this issue, even more so than others, before making an executive decision that could potentially impact those that are receiving long-term care. And that is something that this governor should own. And I do believe will be criticized for in the coming days and months and the year ahead.
Well, Nicholas Oliver, you have certainly educated us tonight. And I'm grateful again for the investment and time you've made with us, because you've laid out very neatly, very cleanly, a twisting series of interrelated events that have had a cumulative impact, which quite frankly is quite dangerous. I think we can agree on that. And there are real issues facing this state, not in the coming months or years, but in the coming days, about potentially what can happen to quality of care for some of our most vulnerable Rhode Islanders. And I'm eternally grateful for that, as I am all the contributions you've made to the coalition over the years. You are officially qualified as a repeat offender now. So
I'll take that as a compliment.
It is. You're in the fraternity. We always close out every show with something we call shameless self-promotion. So please tell folks how they can find out your organization, reach out to them, keep up to date with the developments, and all the information that you offer for a constituency that is amongst the most important in this state.
Yeah, thank you for the opportunity. Our website is the initials of the organization. R as in road, I as in island, P as in partnership, H as in home, C as in care.org. The best way that you can learn about home care and hospice services is looking at a section of our page called Patient and Family Resources. You can also find care, but certainly understand, as we're talking about workforce issues, that care is significantly constrained at this time, and hopefully that will change soon. But to learn more or to find a provider, those patient and family resources are vital. And if any member of your listening or viewing audience has any questions, they can always contact us as well at 401-351-1010. As it relates to the story of the day, if you are a healthcare worker that will be displaced on or before October 1st, or if you are a home care patient or client that will have an interruption of services as a result of your home care nurse or CNA or other professional that will no longer be able to work because of their inability to get vaccinated by that point, my suggestion is to contact the governor. Governor McKee's office is 401-222-2080. Governor McKee needs to hear from members of his constituency about how they'll be impacted. And I hope that we can find a common sense solution that'll be able to minimize the impact before October 1st.
Well, again, thanks for joining us. I know you'll stay in touch. Thank you for keeping us in the loop with your press releases. And please reach out to us. And it's an open door for you, Nick. Literally, you have an issue, just come on over. Show up, and we will certainly afford you every opportunity we can to make sure that everyday Rhode Islanders, not the ones in the bubble, not the ones who are politically connected, not the ones in the higher levels, if you will, those rarefied air of management, but just regular folks understand exactly what's happening and the ramifications of the decisions by our leaders, the wise Solons, if you will, of, as we say here, all credit to Rudy Cheeks, halitosis hall. We are the Coalition, loud and proud, outrage porn-free, civilly disobedient media broadcasting live on the worldwide Coalition Radio Network at coalitionradionetwork.com, facebook.com/The Coalition Radio, on the mighty, mighty Twitter at Coalition_radio. Listen, reach out to us, like us, share us, all that stuff. Independent media relies, if you will, on listener support, not just financially, but also in terms of spreading the message, allowing us a platform so that we can preach to a wider audience. Because quite frankly, I think you've seen over the last few weeks and months, actually throughout this entire pandemic, that it's independent media that's out there at the protests, out there at the hearings, with the questions, challenging, if you will, those that would have us follow them blindly. Folks, stay tuned. In just a couple minutes, we're going to have a brand new show on the air. We'll tell you about it when we bring it up. We're going to be talking, politics, culture, and some of the more challenging aspects of Southwest Asia, of the Middle East, of North African politics. Irina Zuckerman is going to be joining us on a weekly basis now. She was on the air with us a few weeks ago, and we're gonna get a little wonky, but we're gonna get into the weeds, but we're gonna learn together from a completely different perspective on foreign policy. Stay tuned. We'll be right back.